How you doing? It's Dan at Kent Boot Camps. Hope you're well. We're back showing you some super stuff with myself, Dan at Kent Boot Camps, and Steve, Mr. Superhero Osteopath. We're going to be talking about core stability and pain, back pain. Not only back pain, which 1 in 3 of us experience, probably more than that in our lives, but also aesthetics. We see a lot this tight, lovely tight upper abdominals, then we get to about the belly button height and it all hangs out and drops south. So what can we do to assess our abdominals to see whether they're weak and they've got lack of stability? And also what can we do, a couple nice exercises at home we can do to strengthen our core and particularly our lower abdomen. So I'm going to hand over to Steve. He's going to be talking about all the techie stuff, and we're going to be doing some stuff to show you how we can do this. All right, Steve, take it away.
Good afternoon, Kent Boot Campers. Okay, we're here again. We're going to talk about the abdominal wall in the sunshine today. So what is the abdominal wall and what is its correlation to lower back pain? So at least 1 in 3, I think it's more towards 2 out of every 3 people will experience back pain. Dan's going through a little bit of back pain at the moment. I've had back pain in the past. Went off, strengthened my abdominal wall, worked on my stability, worked on my posture. So today we're going to be doing 3 parts. The first part, we're going to be talking about stability. A lot of research at the moment suggests that it's all about bracing the abdominal wall, working in conjunction. So what is the abdominal wall? So it's everything from the diaphragm underneath these ribs here all the way down to the pelvis. Some of these muscles stabilise the pelvis, some of these muscles stabilise the lower back. The ones that stabilise the lower back are called your inner unit. This consists of muscles called your transverse abdominis, external oblique, internal oblique, quadratus lumborum, that sits in here, comes off your 12th rib, multifidus, that runs up your spine, that when you're in the plank position is trying to hold this spine back. They all work together, they don't work individually. We're not talking about just contracting one muscle. We don't do isolation at Kent Boot Camps. We do functional training, whole body movements, so the arms and the legs have something to purchase off. Lunges, squats, things like that. Okay, so we're going to get Dan down. We're going to do a couple of tests to see if his lower abdominal functions. Dan's been working on this at the moment. I've assessed his lower back. He's got problems in his lower thoracic area, so his lower back keeps dropping into extension. So we're trying to create a rounding in his lower back. So we get him to brace his abdominal wall. His hand is under L3, L4, which is opposite the belly button, and we get him to draw his knees in. Now what he's done there is he's rotated his pelvis backwards, and we're going to ask him to just drop his feet to the floor while keeping his lower back and that abdominal wall braced, and his lower back stays on the floor. Can we pass that test? We can pass that test, so if you can do that at home and just see if that lower back arches, and if it does, then that would be an exercise for you. Or you would do single legs. This is now called a lower abdominal test. First one's lower abdominal coordination. Just do it one more time for us, Dan. So we got straight legs as much as possible, bit tight in the hamstrings. Can he get down? You see how he bends his knees because his back is trying to arch, his hip flexors are taking over to try and create that movement and trying to stabilize his spine. The muscles that should be stabilizing his spine and that movement are not working. So what we can do is progress him onto the plank. So this is now an exercise. We know we need to strengthen this abdominal wall because he can't do the straight leg raise, which is quite an advanced. And just drop your bum down a bit more. That's good.
Hang on, let's get this right.
There we go. So you can see his lower abdominal wall is flush against that dowel rod. His thoracic spine is on there. Tuck your chin a little bit more, good, and his head is on the stick. So that would be a perfect plank. So if he was dysfunctional in the plank, what would we see? So he extends through there. You can see now there's a gap between that dowel rod and his lower back, or we see this. Now what's happening there? Muscles on the front of his thigh, hip flexors, lower abdominal wall is not contracting and he's not stabilizing. We're looking to get into that straight position. So talking about stability, core stability is not holding a contraction on a massage table and just bracing your abdominal wall. That is not core stability. Core stability is done through movement. So can we get in that optimal position with that dowel rod or without? And you can see now, if I come down lower, how his whole spine stays in line and he doesn't drop down. As soon as he drops down and arches that lower back, that means his belly's pushing out. So we see that, or we see the bum driving up in the air to use them hip flexors and use them quadriceps. We're looking to stay down, stay in line. So Dan's just going to demonstrate a walkout. Now the walkout is a really good exercise to get down into that plank position. He lengthens through the hamstrings, comes down. The further we go out, the more that lower abdominal recruits, and he gets back in. Make sure to bend the knees to get up through that lower back. And again, Dan, down. So we tuck under, we brace that abdominal wall. Good, and back up. And there we go. So what we had there, we've got a couple of tests. And we've got a couple of exercises that can progress you forward. So do the tests first. Let's get that lower abdominal flat.
Sweet, thanks Steve. Right chaps, well, I hope you enjoyed that. Go and have a go. All you got to do is lie on the floor and move your legs around. It's not too hard. Let us know how you get on. Next week we're going to be talking more about the core. Hopefully you'll find it interesting.